I am Honesty Liller. I am first and foremost a woman in long-term recovery from the disease of addiction. I have been drug-free since May 27, 2007, so almost 15 years. And I'm a proud born and raised resident of Hanover County, as well as a mom of a 12-year-old that attends school here and a 20-year-old that graduated a couple years ago and now is in college and hopefully starting nursing school soon and now works at a hospital. So I have a little bit different perspective. Grace, you're amazing. Your organization is so awesome. And I love everything that you said and everything that you guys do. So you touch my heart every time I hear you. But a couple of things I guess I wanted to discuss tonight is what we see at the McShin Foundation is what I wanted to touch on really quick. As far as I've been doing this for almost 15 years, I went through McShin myself. I did drugs from age 12 to 26. I started out smoking weed here in this county. I did acid and drank, and I just wanted to fit in. You know, I really just wanted to be a part of, I wanted to be cool, whatever that even is supposed to be these days. But I just wanted my friends to like me. I wanted to have friends. I had such a negative outlook at a very young age about myself, about my body, so many different things. I did grow up in a household that was not that great of an atmosphere, to be honest with you. So, and I don't blame my parents whatsoever for my addiction. It's just the cards that I was dealt. And early on, you know, using drugs, you know, specifically weed, like I just, again, wanted to fit in, but I liked it. I'll be honest with you. I liked it. I went to concerts. I had the freedom to do whatever I wanted to do as a child, because of my situation at home. So I was out all the time, in and out. I lied. My name is Honesty, and I lied over half of my life. And I was really good at it. So I got to hide my addiction for 5 years. Well, my drug use, I really didn't get addicted until I was 17. When I was 17, I found heroin and I fell in love immediately. My brain and opiate receptors in my brain went off, had a party in my brain. I remember still the first time I used it. And after that, about a few months later, I overdosed and got Narcan, which Felicia does a good job, you know, training the community about naloxone. So it brought me back to life. And then that's when my parents found out I was on drugs. So for 9 years, they tried to fix me. You know, they tried to fix me. They didn't understand the disease of addiction. They didn't understand why I could not just stop using drugs. And for me, it was a multitude of things. Being on opiates, it attacks your central nervous system. So you need it all day, every day, or you get what we call dope sick, which means withdrawal. So you get sick. It's like the flu times like 500. It's really bad. And it was that void that I kept feeling, that I didn't know how to really be a human. I didn't know how to love myself, and let alone, you know, like myself. And it just kept filling in so many voids in my life at a very young age. And those 9 years were pretty bad. And to my this way, that's my book. It's my first published book. It's a lot that will help you, to be honest, to understand like what addiction is. It talks about my whole life, and a lot of it's about addiction, but then, you know, recovery life rocks, and it's amazing too, and things that I've gone through as a human in recovery and as a mom. But like addiction is real. And sometimes, you know, at McShin, you know, what we see, it's just heartbreaking to me. I'm 41 years old. I'm proud and very grateful to be this old, to be honest with you. I shouldn't even be here, but seeing these kids, and I call them kids, like we have 13 recovery homes. So right now we have like 127 beds for the humans that we serve. We're getting ready to get another house because we're full. So the addiction crisis is huge, and it's gotten even bigger since COVID. And they're young, you know, 20 to 35 range is usually who lives in the McShin Foundation. I mean, we get older as well, but that is the majority throughout the year. And what that means is these humans are already getting addicted to harder drugs at a very young age before obviously they find McShin. And a lot of that is opiates. Opiates and alcohol are really the two main things right now that we've been seeing this past year. And meth is coming back strong. I think it's getting harder since the spotlight has been on the opiate epidemic for about 3 years now, 4 years now. I think it's getting harder for the fentanyl and everything, to come in here. So a lot of people are making meth with all kinds of chemicals. But these kids that come in, they're all walks of life. They're, from great homes, from not so great homes, some are actually homeless. And it is our job as people that are in recovery, because all of our staff are in recovery themselves from addiction, is to try to teach them on a day-to-day basis, not just take away the drugs, but also learn how to love themselves. Most of us, and some of my childhood trauma is in the book, a lot of us come from some form of trauma with no fault of our own. Again, the cards that we were dealt, and not everyone has it, but for the most part, when you unpack your addiction and unpack your drug use, there's always something, and it could be something small, it could be something huge, it could have been ongoing childhood trauma, but for the most part, something happens, and that could be as far as bullying, that could be as someone broke their heart or mentally abused them or physically abused them, but they didn't tell their parents, so that it just kept happening. There's so many stories I hear on a day-to-day basis that break my heart as a parent, and also a woman in recovery, but more as a parent. As I'm getting older, it's really, really affecting me more in my job role, because my kids are getting older, and it's scary. I mean, it's scary out there right now. It's the scariest it's been, to be honest with you, since I've been working at McShin. And McShin saved my life. So I went through McShin when I was 26. I lived there for 5 months. And now both of my kids have been raised at McShin. I mean, we have our own home and everything, but they have definitely seen the realness, especially my daughter, because she was 5. She was born with my drug use. She was born in withdrawal from heroin, and I didn't get into recovery and find McShin until she was 5. So both of my kids have lived experience she has a lot of lived experience because she was born with drugs in her system, but seeing the realness of addiction. So I'm going to spin that a little really quick. So that's just a little background about me. But the realness of like having these conversations like Grace was talking about, there's depression, anxiety, and there's drug and alcohol use. It just is what it is. And for me and my husband's in long-term recovery, like we do the best that we can. And I call myself a real model, not a role model. And what that means in our household is we keep it real with our children. I'm not going to send them graphic YouTubes of someone shooting heroin or anything, but they both know. And Destiny, my daughter, that's 20 now, she knows a lot more than my 12-year-old son about my addiction, and what it does into the humans that we serve at McShin. When so-and-so goes away, where are they going? Most of the time it's jail or death. And my daughter has been to funerals with me because they got close, to a lot of people at McShin, when I couldn't afford babysitters, and, they just needed to be up there with me. And I'll be honest, it's one of the awesomest, coolest place for my children to be. I'd rather them be there than the places I was taking my daughter when I was using. They may hear some F-bombs, but they're in a safe, loving, hugging, caring environment. And that's what recovery is. So my kids, I mean, I can't prevent them from using drugs. Like I can't, there's no way. This is how I parent, hopefully you'll get a couple tips, or judge me, either way, it doesn't really matter, because this is how I'm hoping to stop the generational addiction, in this household. And what we do with our kids is we just have conversations with them all the time, especially my older daughter. But now we're starting to really have a lot more conversations with our 12-year-old son. He'll be 13. There's a lot going on with social media already. And just the whole puberty and who am I and what am I doing, on this planet. And with our daughter, we've been through some things with her, and that's her story to tell. But it's like we have these conversations. It's not for us, we don't in our home say, just don't use drugs, or you're going to get punished. You're going to get punished. You're going to get punished. Like, that's just not how we parent. She has gotten punished. Gosh, taking that phone, you think is the end of the world, but we've had to do it, for some situations that involved alcohol. And you still have to be their parent, right? But on the other end of it, I want my children to be able to come talk to me and be safe with talking to me, because I didn't have that, first off, as a child. And being able to talk to your parent, and like, not necessarily, oh, I can talk to my mom that I just took 10 bong hits and I'm not going to get in trouble. That's not really what I'm talking about. I'm talking about like having the conversation if they do, or if they want to, instead of, you better not do that because you're going to get this, and this taken away from you. My personal and professional opinion is that pushes kids away even farther. So, these conversations that we have with our kids is real. Like, look, man, like, we just talk to them like this is what happens, or how's school, like, what's going on. We take our son's phone and scroll through it. We just started doing that actually last night. He's 12. He has a phone. The only really app he has is some fishing app because he's obsessed with going fishing. But we do check his phone. Like, it's our phone. We pay for the phone. He don't pay for it. So it's our phone anyway. So I think that's like tips I give parents as well, like to remind them, like, you're the parent, and they are the child. And it's our role as parents to guide them through life to the best of our ability, not them tell us what we're going to do and how we're going to do it. Even though they try, like, I get it, they try up in this house, and it doesn't normally happen, for sure. But it's like coming from a loving place, not give me your phone right now, I'm going to go through it and see what you're doing. It's like, if I found something, it was just some random thing. It wasn't even that bad. I'm like, so what does this mean? So it's like more having that conversation with him instead of, you better never do that again. And I don't know, that just never worked for our daughter, like trying to like, don't do this and don't do this. So we just kind of had to reprogram parenting probably about 6, 7, 8 years ago. And again, I'm not a perfect parent, but I'm a pretty decent one, I think. And we have fun, we laugh, we joke, but we were serious in this house. Like, and it's because, like, if I didn't work at McShin, or if I wasn't in recovery, I may not be, I don't know. Recovery is my life, and I thank God for it every single day. But it is how I parent. And I think, when parents call me all the time about their kids, kids come up to McShin all the time under 18 with their parents. They leave them in my office so I can talk to them. They're smoking weed, right? Weed's the big thing right now. And because of the legalization, like, for me, I started out with weed. Ultimately, I ended up doing other drugs. Is it a gateway? I'm not really here, to say if it is or isn't. I know for me, it opened a lot of doors to other drugs. So, like, for us, like, talking to my daughter is like, look, if you're going to smoke weed, just talk to us about it, because unfortunately right now weed is laced with a bunch of stuff. There's so many drugs right now out there that just weren't out there when I was using drugs. So it's like, I've learned all that through the participants at McShin, which is beautiful on the other end. So I can help to parent my child, well, both of them, and teach them what's out there. Like, these pills, they throwing them in these bowls and pick a pill and kids are dying. Like, it's just a really different world. But I do agree with Grace. It comes with like that inner soul stuff. There's so much going on with children right now. And I see it with my own too. My daughter hopefully is getting ready to start nursing school, and this could be some heavy stuff for her. She works at a hospital, nursing school. She got a boyfriend that we may or may not be a fan of. So she's got a lot going on as a woman already, as a young woman. So it's like, I keep having conversations with her, I'm here. If you need therapy, let me know. If you need this, let me know. Like, how are you? I'll randomly, like, if I don't talk to her for 2 days, because she works 12-hour shifts, and she lives still here with us, which is totally cool, kind of, but it's cool. She would clean her room better. That'd be great. But someone else will have to teach you about that, because she don't listen very well. But it's really having constant conversation. And I don't mean like every day, oh my gosh, what did you do today? Who are you with? But it is like having these open conversations that your kids are like comfortable with, and And I don't know. I mean, like, again, I think these are just some of the tips, and also like know who your kids are hanging out with. I think that is like super important. And that's lessons. These are just lived experience lessons I'm trying to give to all of you, that I went through with my daughter because they're 7 years apart. So now we got a little different experience with our son. It's like who like just random chicks would just come here and get dropped off, and like the parents never called me, which is cool, but we don't have alcohol, drugs, cigarettes, nothing in our house. But like, I just thought like at age 12, 13, that was kind of weird, and I wasn't like that. I, at least text the parent or called or whatever. We have Life 360 still to this day with our daughter. She's 20, but it's not like required. She just lets me have it on there for my own mental illness and my worry and stuff. So, I think it's like really understanding like what addiction is and what drugs are out there, because they are a lot. I'm not here to scare you, but there is a lot, and it's a ton of fentanyl. And unfortunately, the humans, that are using it are thinking they're taking something else, and it's fentanyl and they're dying. I mean, I'm just being honest with you and real with you. It was 100,000 deaths nationally. We finally hit that huge number, which is a horrible, horrible, sad, horrific thing. Across the nation this past year. The data is out on that. So, keep it real, be a real model, to your child, and do the best of your ability to not only talk to your children, but give yourself grace, and I think that's a lot of lessons I've had to learn as a woman and as a mom, is like giving myself grace, because when I am like in an anxiety mode or depression and stuff, I have to like give myself grace, but also check that as well and call my support network. So have some, parent friends or support groups. There's a ton of support groups out there, for yourself, because for us, society now, even with the COVID, the isolation, it's still kind of go, 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 go. So it's important to like make the time for your children too, even if they want to hang out with their friends like every day. I think it should be like a kind of mandatory thing, at least once every other week. Y'all have dinner together. We're doing a puzzle in here, me and my son. So I think it's, you're the parent. Like, just remember that you're still the parent. You can be cool and have these open conversations, but in reality, you're still their parent. And your role on earth is to guide them to the best of your ability. So, I'm here to help. McShin talks to parents all the time. We have support groups. We have, you can bring your kid up there. I'm 41, but I have a lot of younger staff too that have a ton of lived experience with addiction at a young age. It's not just me. I have a ton of staff that can help as well. So just give yourself a little bit grace, but also have those open conversations with your kids and let it be a safe space, because there is so much more, like Grace was saying, for these kids with the social media and just like who likes who and body image for these girls. And it's just, and then, how they identify as a human. I mean, this world is just, it's a place to learn. It's a place to learn, and why not start in your home? I tell everybody all the time, and I'll be quiet. I can help people all day long, and I do it nationally. It just, what I do has to start first in my home, though, because the reality of our next generation is living in my home. So in order to help the world, I have to be, a parent to my children, but also have them be able to have a safe space to talk about what they're going through, so they don't live in a bubble and then, do things that they may or may not regret as an adult. So that's all I have. Thank you for having me.